Hi everybody. Today we are talking about how to connect aging and health declines to the status of aging parents who need care from family members or you as the adult child. If you are a caregiver for an aging adult, or you may even worry about your own health, you might be trying to make these connections so that you can estimate the amount of care that you might need in the future, or the amount of care that an elderly parent might need in the future. Because you could be working and doing other things, and you're trying to juggle everything and manage your time, and also manage your money if you're going to need money to pay for any type of care. Now, let's be honest. Most people do not like to think about this or even talk about the idea of needing any type of help or who will be their caregiver, who will help out, until disaster strikes and the need arises. Most people also think that Medicare covers all these costs. Well, it doesn't. In this video, I'm going to offer information about telltale signs that you can look for in yourself or in aging loved ones to indicate that there is something going on, there are changes going on, and more care or more time devoted to taking care of your health may be needed. To do this, I'm going to talk about two acronyms, which are abbreviations that doctors and nurses and the healthcare system use that probably go over the head of most caregivers. They're called ADLs, Activities of Daily Living, and IADLs, Instrumental Activities of Daily Living, that you may not realize, but these are so significant. They are telltale signs that there is something going on. So in addition to giving background about what these are and why they're important, what you should watch out for, I'm going to share the physical and the mental risks related to these factors and why it's important to have early conversations that honestly may be super uncomfortable with your loved ones, or, super uncomfortable with yourself, to ask and to look at how these tasks are being managed. Because if you can keep these up, you, elderly parents, elderly loved ones, can continue to live independently and not need more of a caregiver's time or a caregiver's money. So, if you haven't been here before, I'm Pamela D Wilson. I'm a caregiving expert, advocate, and speaker. You can go below this video to find information about me, information on my website, lots of helpful information. Please like this video, follow my channel, and comment, even if it's only to say thank you. Your participation helps other people looking for similar information to find their way here. So let's get back to activities of daily living, which are things that we all do. It's likely that you probably don't pay attention to a lot of these things, or even understand the importance of having conversations with aging parents or grandparents about these tasks, and the fact that if they're unable to do these things, that means that somebody is going to have to step in. So if this is your situation, I will take you through all the risks that you may not be aware of, so that you can identify these before they become a problem. If you're already in the stage where you are caring for somebody, probably more than likely some of the additional information I will share can help you prevent the care situation from getting worse. Because the best way to avoid needing care is to learn how these factors affect care and be proactive before they become a problem. So let's start with the definitions. ADLs, IADLs. Activities of daily living, instrumental activities of daily living. So activities of daily living are things that you and I do every single day, and we probably don't think twice about them. But as we age, these skills become more challenging to perform. And when people can't do these things, like the people that you may be caring for already, You start helping out, family members start helping out, and they become the reasons that most elderly people have to leave their homes to go to an assisted living community or a nursing home where honestly nobody wants to live. So having conversations about your loved one's ability to perform these is important. There are 5 of them. Okay? The first one is bathing. You might not think twice about it. Take a shower, you bathe every day before you go to work. Takes you 10, 15 minutes, you're in, you're out, you're done. Well, for older people, all these personal hygiene tasks that include bathing or showering, brushing your teeth, shaving, washing your hair, trimming your toenails, your fingernails, putting on lotion. When people get older and experience physical weakness, older people don't have strong muscles in their legs anymore. They may not be able to lift their arms. It may be a struggle to get a leg up and over a bathtub to get into the bathtub. And then imagine this, if you don't have strong leg strength or strong arm strength to be able to push yourself up, what happens if you get in the tub and you can't get out? It happens. Anyone who has poor balance has likely almost had a slip in the tub or the shower. How many of us who are strong and healthy and have good balance have almost slipped in the shower because the surfaces are just slippery? Older adults shower and bathe less because they may have almost had a slip or a fall. Now they're afraid to get in that bathtub. And the statistics confirm that falls that happen in the bathroom are pretty serious because there's a lot of hard surfaces there. Tile, porcelain from the tub, porcelain from the sink. Falls for older persons in the bathroom often result in a broken bone or a hip fracture, something serious. So, uncomfortable conversation, right? Ask your parents if you're noticing that they have body odor, they're not changing their clothes. Ask them if they're afraid to get in the shower or the bathtub. If they are, start talking about alternatives. Offer to purchase one of those handheld shower extensions or a shower chair that they can sit on. Offer to put grab bars in the tub or the shower so they have something to hold on to when they are getting in or getting out. You can buy a rubber shower mat to put on the floor of the shower or the bottom of the tub. These little safety modifications can avoid such serious injuries that really could cause your loved one not to be able to continue to live independently and have to move out of their home. Be proactive and have these uncomfortable conversations. The next activity of daily living, number 2, is toileting. It's going to the bathroom. Similar risky conditions can exist for sitting down and standing up from the toilet, again, if your loved one isn't physically strong. Weak leg muscles, weak arm muscles, poor balance. I would say that more older adults are physically weak than are physically strong. So, how do you know? Watch your parents when they get up from a chair anywhere in the house. Watch them when they get in and out of the car. Are they struggling? Are they rocking back and forth to get some momentum to get up? Do they need to really use their arms to hold on to something to pull them up? If they do, they're probably struggling to sit down and get up from the toilet, which can be extremely embarrassing for anybody to admit. So what do? You can place a grab bar on the wall by the toilet. You can install what's called a high-rise toilet. You can purchase a lift seat or a toilet riser. Let me take you through these. So a normal toilet, 15 to 16 inches off the ground. A high-rise toilet, 17 to 19 inches off the ground. Those 3 inches can make a huge difference for people who are physically weak, have bad knees, any kind of back pain, any kind of physical disability. can make it easier to get up off the toilet. There are also toilet lift seats. What does that look like? So when you think of a toilet lift seat, think of those chair recliners that you might have seen on television that kind of, you push a button and they go up, right? So it's kind of like a chair recliner that helps people stand up more easily if they don't have the physical strength. Well, the toilet lift seat is pretty similar. It fits over a toilet and it helps a person stand up. Then there are more inexpensive things called a toilet riser, which is a plastic device probably about, that tall, that you put on top of the toilet. Again, the idea is raising the height of the toilet so that the distance to stand is not as great. There's a couple of other options. There are also what are called bedside commodes, which is, it can sit over a toilet and it has a bucket underneath. You can also put these by a bed at night if your parent has fallen in the middle of the night on the way to the bathroom. Then all they have to do is stand up out of bed, sit down on the commode, do their business, and they're done. Now, obviously, it has to be cleaned out in the morning, but these bedside commodes are multi-use because they can sit by the bed at night, and if somebody does have the strength, they can come and just be placed over the toilet the next morning. All of these hygiene tasks, bathing, showering, going to the bathroom, they're important because they're activities we all do every day. They also help us maintain good skin quality for older adults. They help avoid urinary tract infections, which are very common, especially for older adults who have dementia. Then let's look at the simple task of brushing and flossing your teeth. We should do it at least twice a day. Anybody who has arthritis or hand pain, it can be more difficult. Getting floss in and out of your mouth can be a little bit of a task. There are flossing picks that you can buy that you can just do this with, right? You don't need a piece of long floss. There are electric toothbrushes, which are great for getting plaque off teeth. And one thing that might surprise you is your dental health, the quality of your teeth, makes a huge difference in your health because older adults who don't brush their teeth every day or who have infections in their teeth or gums are more likely to get pneumonia, which then sends them to the hospital. So if you think of this, if your parents are having any type of dental infection, it can be very serious. If they're having dental problems like bad teeth, they're probably also having problems chewing or eating. Good nutrition is extremely important for the elderly. So these, again, are things to talk about in a nice way. Mom or Dad, when was the last time you had your teeth cleaned? Have you been to the dentist lately? I'm going next week. Should we set an appointment for you? Now, dental care is expensive. This is another place where caregivers find that they end up spending money to help their elderly parents get dental cleanings or get dental work or get dentures. Another problem area for older adults are fingernails and especially toenails. If your elderly parents are not physically flexible, like can they bend down and touch their toes? Can they sit down and sit up? They're probably having problems reaching their toenails to cut them, right? They can't bend their leg up close enough to the body to go down and trim. Or, if your parents have any type of shoulder issues, they're probably having problems raising their arms just to wash their hair. So, again, you can offer to trim their fingernails, give your mom a manicure, get out the file and just do that. Offer to trim their toenails a couple of weeks, help them wash their hair if they can't raise their arms due to arthritis or shoulder pain or physical weakness. When you think about this, how long can you do this? How long can you hold your arms horizontally without them getting tired? How many times can you personally stand up from a chair using only your leg strength and not holding on to anything? The arms of the chair, not pushing yourself up from the bottom of the chair. Strengthening exercises exist for all of these activities of daily living. So if your elderly loved ones are in any way physically weak, encourage them to participate in some type of exercise program or to request a physical therapy visit from their doctor. You actually have to go to the doctor to do that. Other ways to test. Ask your mom and dad to go on a walk with you. Say, Mom and Dad, let's go walk around the block. Can you walk for a block or 2 blocks? Or if there's stairs, can your parents walk a flight of stairs without getting out of breath? All of these things are little tests, including, and this is a big one, how long can you stand on one leg and balance? How long can your parents stand on one leg and balance? My guess is if they're physically weak, they probably can't. They're probably going to start falling over. All of these little things, so very, very, very important. Let's talk about activities of daily living number 3, which is dressing. Again, you do this without even thinking about it. Well, for older people, it can be challenging because it can require hand and finger dexterity to button buttons or snap snaps, use zippers, bend over and put socks on the feet. If your parents can't cut their own toenails, they may have difficulty putting socks on or putting shoes on or tying the shoelaces. There are a lot of helpers for these activities. Years ago, my dad had a bad back, so he had problems bending over and putting on his socks and his shoes, and he struggled. So there is something called a sock assist device that helps you put on socks. He used a shoehorn to slide into his shoes. He eventually got shoes with Velcro straps instead of shoes that had shoelaces. So there's adjustments that you can make, but honestly, if you're not with your aging parents watching them dress or watching them bathe, you're never going to even know that these are problems, and they're certainly not going to tell you because these are all points of self-esteem and pride. Gosh, I would never want my kids to know that I'm having trouble with this. Perfect example. My dad was visiting. He needed help getting in and out of the shower, which was in a bathtub, because he had trouble lifting his leg over the shower. And he said to me, oh my gosh, this is hell having my daughter A, see me like this, and B, having my daughter have to help me get in and out of the shower so I don't fall. It's embarrassing. So be very kind and be very patient when you talk about these things. Activity of daily living number 4, transfers and mobility. I put this one forth because it relates to everything we just talked about, the bathing, the toileting, and the dressing. All of these require physical movement and some level of strength. Walking, sitting, standing up from a chair, getting in and out of bed, getting in and out of a shower, putting your leg over the bathtub rim, standing up from a toilet, walking up and down stairs, carrying groceries, putting food away in cabinets, taking the trash out, mowing the lawn, shoveling snow. All of these activities can become very difficult with time if you do not exercise to maintain physical strength and cardiovascular ability. All of these physical issues, strength, muscle mass, start declining at age 30 unless you do something to preserve them. Now, the good news is that if you haven't done this and you start doing it at any age, you can gain physical endurance. You can gain muscle strength. And by doing this, you increase the likelihood of being able to continue to do everything that you've always done, things that you enjoy, longer. Plus, let's add the mental positives, right? Being physically able to do things gives you a sense of self-esteem. Wow, I used to be able to carry a 20-pound bag of mulch out to the garden. I can still do it. I can pick up that bag. Being physically able is a great boost for the mind. People who are physically active, those who exercise, socialize, they're more positive. They respond in a more resilient manner when unexpected things happen, when things don't go right. It takes a lot of mental effort to work through any type of physical decline or illness and remain positive and resilient. And this is extremely, extremely important for everybody, especially as the body ages. With age, it's important to be the person who falls down and gets back up and is not injured. It's important to be the person who looks at the positive side of things, even though, there are things that don't go right all the time. This happens to us every single day. I don't think many of us have the perfect day every day. So being physically strong, being mentally strong, helps you manage all of this a little better. Activity of daily living number 5, eating. We eat every day. What matters is what we eat, when we eat, how much we eat, and the quality of what we eat. A lot of people don't have breakfast. Breakfast kind of kickstarts the body and the mind because after sleeping, the body can be dehydrated and have low energy. And this is especially true with older people who tend not to drink enough water or fluids. This healthy breakfast, boosts your immune system. It gives your body fluids. You're hydrated again. Gives you energy so that you can go on with your day. It lifts your mood. It improves your concentration, your ability to focus. Now, what you eat is another big deal. Eat as many non-processed foods as possible. So what is that? It means things that you actually make for yourself. Yeah, that is the pits, right? It requires time. Fruits, vegetables, whole grains. Fast food, not good for you. Highly processed foods, not as good for you. Fried foods or foods that have high sugar or salt content, not really doing you any favor. They taste great, they're convenient, but are they raising your blood sugar, your cholesterol, your triglycerides, your blood pressure? My dad used to love olives in a can. The salt content of black olives in a can is off the roof. He couldn't figure out why his blood pressure was so high. He stopped eating the olives from the can. His blood pressure dropped like a rock. So it really is important to watch, what you eat, when you eat, because good nutrition, especially as people get older, is important. Now, let's look at the IADLs, the instrumental activities of daily living. These are activities, again, that you probably do every day. You don't think twice about it, but these support the 5 ADLs that I just talked about. So if your loved one wants to continue to live in their home independently and not need help from a caregiver, not burden you, or if you don't want to be that caregiver who sees all of this happening and you're thinking, oh my gosh, it's only going to get worse. It's going to take more of my time. I'm going to have to contribute financially. Have these conversations. Ask these questions. Now, if you're still working, a lot of these IADLs that I'm going to talk about, you're going to see them as, oh my gosh, things that I have to do that I don't want to do. You're going to see them as like drudgery, right? But for older people who are retired, if they're not active, if they don't have friends and hobbies and they're continually doing things, they can have a lot of time on their hands. These instrumental activities of daily living can become their new projects, their new job. And depending on their commitment to be healthy, all of this can fill up their days with constant activity. If you have a parent that says to you, I have nothing to do all day, I'm bored. If they call you 10 times at work because they don't have anybody to talk to, that indicates there is a potential problem. So these are things like cooking a meal, cleaning house, doing the laundry, going shopping, running errands, paying bills, managing money, using the telephone to make doctor appointments, to call friends, to socialize, managing and taking any medications related to health problems, going to doctor appointments, and other household projects like, home repairs, mowing the lawn, snow removal, washing clothes. And then if we add on to this, participating in social activities, maybe even volunteering, maybe even working a part-time job one day a week so that your elderly parents have something to do and they stay mentally sharp. And then there's exercise like playing golf, fishing, tennis, aerobics, water aerobics, swimming, anything that keeps them mentally and physically active. So you might wonder how people develop difficulties doing these things. There is a link between health over here and physical ability and strength and chronic disease over here. So, if your elderly loved ones are bored, they don't have anything to do, they're starting to do less, they seem a little depressed, a little unhappy, the culprit may be the fact that they don't feel well. Having an illness, a chronic disease, can make performing all of these activities of daily living and instrumental activities of daily living more challenging and more difficult. So again, it's talking to your parents who may say, oh, we're okay, we don't need any help, or things are going great, but yet you're noticing these little things that are saying, things are not so great, right? I think something's going on there. So examples. If your parents have COPD, asthma, any type of breathing problem, that can make exercise or anything that results in physical exertion more difficult, right? Bodies need more oxygen if they're going to perform activities that are physically exerting. You go for a bike ride, you're breathing harder. You walk up steps, you're breathing harder. You run, you walk, you're breathing harder. Not exercising causes physical weakness. If your parents have arthritis, right? Maybe they're just sore and they're limiting their physical activity. Well, part of the thing about physical activity is if your body is weak and you start doing it, you're going to be sore. That soreness, believe it or not, is a positive indicator, even though it can hurt for a few days, right? Or for a few weeks until your body gets adjusted. But that's a positive thing. And so things that might surprise you. 40% of people between the ages of 65 and 79 have difficulty with at least one or more of these activities of daily living that I talked about, or instrumental activities of daily living. The only way you will know is if you start talking to your parents about this. Other conditions that are going to indicate that their health is not good or it's getting worse can include mental health problems, psychological problems that maybe they've had all their life, and maybe your mom or dad passed away, leaving the other one, and you're thinking, oh my gosh, was my mom or dad like this their entire life, and my mom or dad who died kind of hid all this from us children? That happens all the time, more than you would think. Memory loss can cause problems taking care of oneself. Having a fall and being afraid to fall again and limiting physical activity is a problem. There are so many challenges that can be identified. And so when we look at all of this, we're kind of looking at, why do these statistics matter? They matter because in the scheme of trying to prevent health from worsening, it's important to know that these exist. And so women, believe it or not, over the age of 65 are more likely than men to develop these disabilities and need what's called long-term care, which means caregivers coming into the home or moving into a care community. Now, why women, you might wonder, right? What is it about women? Well, women take care of the husbands. The husbands pass away first. There's no spouse to take care of the women. And sometimes there's no children to take care of the women who are mothers. So women are more likely in a position to have to be cared for by family members or people outside of the family. So if you're female, it's even more important to stay physically fit so that this doesn't happen to you. Knowing these statistics, knowing this information can help caregivers of elderly parents. It can help you as an individual understand the benefit of creating and beginning to work on positive health habits like exercise and nutrition and weight management and not smoking. So the bottom line is, unless you're in regular contact with your aging family members, unless you start talking to them about things that they can do, things that they can't do, by saying, I'm noticing this, how are you doing with that? Or do you need a little bit of help with this? Is there something we can do to modify the family, home, the bathroom, maybe stair rails, that lift chair, something like that. Now, you don't want to do too much too early though, because there's this catch-22. If, let's say that you get a lift chair, a regular lift chair for an elderly parent, that is going to make them less likely to improve their leg strength and their arm strength. So it's better to fix the root cause, the root problem, before you install these devices in the home. That being said, slipping in the shower, we all could do it. So a grab bar, probably a no-brainer, because you or I could slip tomorrow. And if we don't have something to grab onto, we're probably going to get hurt. The other thing is, when you have these conversations with your parents, realize that they're probably going to overestimate their abilities and the things that they do, because they think that they're 20 years younger than they are. Don't we all, right? We all want to believe that we can still do all these things, and sometimes we can't. So as the caregiver, just kind of watching these little things, having conversations with your parents, making some notes so that you remember, I talked to mom or dad about this 6 months ago. I'm talking to them now. What has changed, if anything, and how significant is that change? That information is so important. So all of these little things, these details, they make a difference in helping elderly loved ones stay at home. And it can feel like, a lot of work, a lot of tracking. You're having to have conversations you don't want to have. But when you think of things that can make your life easier as a caregiver, that can make your time commitment less, that can make any financial commitment you have to make less, being proactive over here can save you so much on the back end. I also recommend, what's good for the goose is good for the gander. Start a tracking system for yourself based on what you can do today versus 5 years ago. Activities that you do today versus 5 years ago. If you're not golfing or playing tennis or hiking, why not? What has changed in your life? Are you more tired? Are you physically weaker? Is there something else going on? Because physical activity is associated with better health status in every person across all ages. That low level of physical activity, you're just more tired all the time. You're weak. So there are so many benefits. Exercises for older adults can reduce that likelihood of a fall, improve their balance, to help them do things more for themselves rather than you being the contributor. So you have a huge opportunity to notice changes in activities of daily living and instrumental activities of daily living. And if there are chronic illnesses present that your parents may not tell you about, mom or dad, what do you see the doctor for? Do you have high blood pressure? Oh, I see a pill bottle. What are you taking these pills for? If those exist, they can become more manageable because of being more physically active and taking an interest in nutrition and health and things like that. So as a caregiver, it's important to kind of be a cheerleader, be a motivator for your loved ones. Not that they will follow your examples, but you can offer, and to do these things for yourself. So I'm Pamela D Wilson, caregiving expert, advocate, and speaker. You can learn more about me by clicking on the links below. There are links to online courses on my website, my podcast, The Caring Generation, my book, The Caregiving Trap. Also, please do like this video, follow my channel, share it with other people, comment, even if it's only to say thank you. Your participation brings these videos to be accessible to more people looking for similar hope, help, and support all over the world. So please, I encourage you to participate here. Thanks for being here. Have a great day. I will see you all again soon in another video.